Okay, here's a quick walkthrough of cardiac output calculations, all right? So, simple formula. We have stroke volume times heart rate equals cardiac output, okay? So, stroke volume is milliliters per minute. Stroke volume is milliliter per beat. Heart rate is beat per minute. Beats cancel out, so cardiac output is milliliters per minute, okay? And remember, we can convert stroke volume into its calculation, which is end diastolic volume minus end systolic volume. Subtract that end systolic volume from end diastolic volume, and that equals stroke volume. Subtract the least blood in the heart from the most blood in the heart, and that gives you stroke volume, the amount that's ejected in one beat. Okay, so three factors that affect stroke volume, and as a result of affecting stroke volume, have an effect on cardiac output. So first on the list is preload. Preload is the amount of stretch of the muscle in the ventricle before contraction. Right, so there's an optimal length for those muscles. Too short, they don't generate a lot of tension. Too long, they don't generate a lot of tension. So somewhere in the middle, there's this optimal stretch for those muscle fibers that generates preload. If preload goes up, then what that would mean is there's a higher stroke volume. How do we get there? Okay, so now it's going to make a difference knowing how we increase preload. So preload affects EDV. Preload is a measure of EDV, right? So there's two ways that we can change this. One way that we can increase preload is that, let me back up a second. The way that we increase preload is we increase filling of the ventricles, right? So there's two ways to increase filling of the ventricles. One, we can have a slow heart rate. Slow heart rate equals more passive filling. More passive filling will increase preload. More filling equals higher amount of blood in the heart before contraction. Now, here's the only drawback. The way that we get lower heart rate is by parasympathetic, sympathetic innervation, right? So this shouldn't be that hard of a conclusion to draw. Parasympathetic innervation is decreasing the heart rate, which gives us more passive filling, which increases preload, which increases EDV, which increases stroke volume. However, parasympathetic innervation will decrease heart rate. And so, what is the effect of more passive filling on cardiac output? Depends on how low heart rate is because of that parasympathetic innervation. So what about during activity, right? So during activity, we want to increase stroke volume, and one of the ways to do that is by increasing preload. So what we see on the other hand would be sympathetic innervation. So sympathetic innervation will increase heart rate. Increased heart rate will decrease passive filling. So how do we affect preload? It has to be some separate mechanism. And so what we see is increased venous return. Now, venous return, what that means is we see the veins constrict. We see increase in motility, and that all helps to bring more blood back to the heart. So that increase in venous return increases EDV, increases stroke volume, and because heart rate is going up during sympathetic innervation, we're definitely going to see an increase in cardiac output. All right, second on the list, second thing that affects stroke volume is going to be contractility. contractility, is a measure of the contraction of the ventricular muscle regardless of preload, regardless of the amount of stretch before contraction. So instead of affecting EDV, contractility affects ESV. For contractility, if contractility goes up, stroke volume is going to go up, but this is where you have to be careful. If contractility goes up, that means the muscle, regardless of where we started, contracts more vigorously, so the amount of blood left in the heart actually goes down. So regardless of where we started, if contractility goes up, ESV goes down, and as a result, stroke volume goes up. Now, what increases contractility? Sympathetic innervation. So sympathetic innervation has this dual process where we can both increase venous return, increase contractility. So preload is going up, EDV is going up, contractility is going up, ESV is going down. So stroke volume can go up a great deal because of the change in both of the variables. And then heart rate is definitely going up, so that sympathetic innervation will absolutely increase cardiac output. The one variable that creates a effect that is contrary to what we want is what's called afterload. Afterload is a measure of the pressure required to open the AV valves. Sorry, back that up, not AV valves, semilunar valves, right? So the ventricles have to increase in pressure in order for those semilunar valves to open up and eject blood. So if there's a higher pressure in the aorta, meaning you have high blood pressure, that means it will take more pressure to open those semilunar valves, and as an effect, stroke volume will go down. The way stroke volume goes down is that afterload affects end systolic volume because there's less blood that's ejected, which means there's more blood left in the heart. So as afterload increases, it increases end systolic volume, which reduces stroke volume. So those are the three factors that can affect stroke volume to affect cardiac output.